Hello future doctors, welcome to Dipenism. I am Dr. Dipen Shah and today we are going to discuss a very important topic from anatomy, that is mediastinum. Now the word mediastinum means the middle compartment. It is specifically present in the thoracic cavity and it is essentially the space which is present between the two lungs. Now the space between the two lungs has a very vital organ, that is the heart, and that is why the study of mediastinum is very important. What we are going to discuss overall is the contents, the divisions, that is superior and inferior mediastinum, the boundaries, as well as about its clinical anatomy. So let us first discuss the boundaries of the mediastinum. As you can observe in this diagram, there are certain structures which have been made in order to define the boundary of mediastinum. So it has an anterior boundary, it has a posterior boundary, it has superior, inferior, and it will have lateral boundaries as well. Anteriorly, the boundary of mediastinum is formed by the bone, that is the sternum. And sternum consists of three parts, that is the manubrium, the body of the sternum, and the lowermost part, that is the xiphisternum. The posterior boundary is formed by the vertebral column, and specifically these are the 12 thoracic vertebrae, since it is enclosed in the thoracic cavity. The superior boundary is formed by the thoracic inlet, which is an imaginary line extending from the upper border of the first thoracic vertebrae up to the manubrium. The inferior boundary is formed by a muscular partition, that is the diaphragm, and the diaphragm is the muscle which divides into thoracic and abdominal compartments or the cavities. The lateral boundaries are going to be formed by the pleura, and pleura is specifically the coverings of the lungs. So this we have discussed about the boundaries: anterior, posterior, superior, inferior, and the lateral boundaries. When we discuss about the two divisions, that is the superior and inferior mediastinum, these divisions are formed by an imaginary line extending from the sternal angle to the lower border of the fourth thoracic vertebrae. So it's a horizontal imaginary plane which is extending from the sternal angle up to the lower border of the fourth thoracic vertebrae, which divides the mediastinum cavity into superior mediastinum and the inferior mediastinum. Now even the inferior mediastinum has been divided into three different parts by presence of a vital structure, that is the pericardium. Now what is pericardium? Pericardium is the covering of the heart. So pericardium and its content, that is the heart, divides the inferior mediastinum into three different subdivisions, and those subdivisions in front of the pericardium is known as the anterior subdivision of the inferior mediastinum. Then there is the middle subdivision of the inferior mediastinum, which specifically contains the pericardium and its content, that is the heart, and the posterior subdivision of the inferior mediastinum. So the pericardium is dividing the inferior mediastinum into anterior, middle, and posterior compartments. So far we have discussed what is mediastinum, why it is important to be studied because of the presence of the vital organ, its boundaries, and its division. Stay tuned for my further videos where we'll be discussing about the superior and inferior divisions and its contents in details. That's all. Thank you from Dipenism.